And thank you. And for the remaining time, I would like to talk about the clinical application of the liver elastography. The topic will include the clinical background and major application, that is liver cirrhosis, and other factors that may affect liver stiffness. And last, I will talk about some of the perspective of the liver elastography. And liver cirrhosis is the final stage of chronic liver disease, and it causes a significant burden for healthcare system worldwide. And it is estimated about 1 million of deaths caused by liver cirrhosis worldwide in 2010. Causes of liver cirrhosis mainly include hepatitis B, chronic hepatitis C, alcoholic liver hepatitis. And in recent years, non-alcoholic steatohepatitis has been identified as another important cause of chronic liver disease. Chronic liver disease is characterized morphologically by repeat liver injury and regeneration. After repeat liver injury, the liver became fibrotic with deposition of the fibroblasts in the cellular matrix. If untreated, this will progress to liver cirrhosis, and liver fibrosis and cirrhosis increase liver stiffness. Traditionally, physicians will try to make the palpation to evaluate the liver stiffness, but it is quite difficult. It needs physicians' experience and skill, and there is no way to quantify or recording the degree of liver stiffness. Liver is located beneath the abdominal wall and the rib, so it is quite difficult for palpation. And liver elastography provides us a way to explore the stiffness of the liver. In the image, we can see there is a tumor sitting in the left lobe liver. By using the static elastography, we can obtain the strain imaging in this area, and we can see that the stiffness is presented in the grayscale. The location corresponding to the tumor looks stiffer, as shown in the grayscale imaging is darker here as compared to the surrounding liver tissue. So in this way, liver elastography provides us a tool to virtually palpate the liver or the pathology in the liver. So this technology cannot be achieved by other imaging modality. And liver elastography can be categorized into two categories, include shear wave or strain elastography. For shear wave elastography, FibroScan or transient elastography is the first available clinical tool to evaluate liver stiffness. And more recently, there comes the acoustic radiation force impulse used for generate the shear wave velocity. And there are several main factors doing on this. And also, there is a technique using the strain elastography to semi-quantitatively evaluate the liver stiffness. In this slide, I would like to present that nearly all of the major vendors in the world producing ultrasound machine has provided either strain or shear wave elastography on their high-end version of ultrasound machine. For FibroScan, it provides quantified data of the liver stiffness displayed in the kilocaspa, but it provides no imaging information. For ultrasound-based elastography, like point shear wave elastography, it provides numerical data of the shear wave velocity, and also it gives us imaging information to show what the region we are actually measuring. And for supersonic shear imaging, it is able to provide a real-time display of the shear wave velocity or stiffness in real time. And also it can measure the quantified data for us. So with this, now we know that liver stiffness increases in liver cirrhosis, and we have a tool, elastography, for measuring of the liver stiffness. So intuitively, people will ask if there is a correlation between the liver stiffness measured by the elastography and the degree of liver fibrosis. So there is tremendous effort working on this topic, and the results are encouraging. Let's take RFI as an example. And Casinoto has performed RFI measurement in the healthy liver and those with different degree of liver cirrhosis. For fibrosis stage 4, it is identical to liver cirrhosis. And for stage 1, 2, 3 means the mild, moderate to severe degree of liver cirrhosis. We found that the shear wave velocity measured by RFI increased as the degree of liver fibrosis progressed until liver cirrhosis. And for other imaging modality, such as supersonic shear imaging or fibroscan, the result on this topic are pretty much the same pattern. And for clinical application, it will be useful if we can figure out some cutoff value for differentiation between the normal liver and the liver fibrosis or cirrhosis. Braley has performed a meta-analysis using the RFI technology, and he found that he can define some cutoff value to differentiate the normal liver from different degree of liver fibrosis. And the performance of this cutoff value, as shown by the AUROC, are looking quite well, and regardless of the cause of the liver disease. And let's look at some example here. A normal liver looks normal in the CT scan and the ultrasound, and we measure the shear wave velocity using RFI. It shows value of 1.15. For another case, it is clearly cirrhotic by CT and ultrasound image, and we measure the RFI. The value is 2.63, significantly higher than the normal tissue. So this is a normal liver versus liver cirrhosis, and it is very obvious that the elastography demonstrates a stiffer liver in the liver cirrhosis. In another case, we can see the liver looks not so bad, although it has some splenomegaly and varices here, but the overall appearance of liver is equivocal for us. For ultrasound, it shows somewhat coarse liver echo, but there is not so obvious sign of significant cirrhosis in this situation. But if we measure the shear wave velocity, it is higher than normal range, 1.8. And this patient received liver biopsies, and the result shows cirrhosis. So in some situation, measurement of the liver stiffness using elastography may help us in the diagnosis or management in patients with suspicious of liver cirrhosis. And now I'll talk about some of the other factors that will affect liver stiffness other than liver fibrosis. These include technical or biological factors. I will focus on the biological factors in this talk. Because liver is not a purely homogeneous organ, in addition to hepatocyte and the interstitium, it contains vessels, including artery, vein, and bile ducts. So the pathology or abnormality in the vein, for example, hepatic venous congestion or bile duct cholestasis, may increase intravascular or bile duct pressure. And the inflammation in the hepatic tissue, such as hepatitis, may increase interstitial space or osmotic pressure. And this result in the compression of the liver tissue and lead to increased liver stiffness. And this is a patient with acute hepatitis, and the liver looks swollen with inhomogeneous density on CT scan. And we used the RP to measure the shear wave velocity. It was very high, up to 2.7. And this measurement was done during the marked elevation of the liver enzyme. So inflammation in the liver increased liver stiffness. And other physiological status also may affect liver stiffness as well. In this case, we can see a patient with liver cirrhosis. We measure the shear wave velocity during fasting and postprandial status. We take 10 measurements, and the mean value shows that there is significant increased liver stiffness in the postprandial status. The stiffness of liver is affected by the status of fasting, especially in those with liver cirrhosis. And this is the case with liver transplant, and he suffered from the hepatic venous stenosis shortly after transplantation. And we are using the supersonic shear imaging to evaluate the liver stiffness before angioplasty of this venous stenosis, and we compare the stiffness before and after the angioplasty. It was obvious that the liver stiffness decreased after angioplasty for treatment of venous stenosis. As we can see, the color scale decreased in intensity of the color, and also we can quantify the degree of stiffness before and after the treatment of angioplasty. So venous congestion is also a confounder of liver stiffness. So in addition to liver fibrosis, many other factors may actually affect the liver stiffness, but many of these factors result in increased liver stiffness. So instead of assessment of liver fibrosis, actually liver stiffness is probably another biomarker for assessment of the liver disease, because a stiffer liver always means there is something wrong in the liver or something wrong that may affect the liver function. So liver stiffness has been used in many other aspects. For example, it can be used to predict the treatment outcome of the various liver disease or predict the prognosis of the patient with liver disease. It has been used to predict the outcome for patients after hepatectomy and using for prediction of the outcome after liver transplant and assessment for the risk of liver cancer and prediction of the treatment response of the liver cancer both in localized or systemic therapy. And we have been using liver elastography for evaluation of the patient before transplant. We found that there is a significant correlation of the liver stiffness and the MELT score, which is a scoring system that assess the severity of the chronic liver disease. And this shows that there is a high correlation between the MELT score and the liver stiffness. Interestingly, the liver stiffness before transplant is actually related to the outcome of the patient in the short-term base after liver transplantation. As we can see, if the patient has a higher liver stiffness before liver transplant, the short-term mortality after transplant was higher than those with softer liver. And there's other studies working on other aspects. For example, for hepatitis B and hepatitis C, other researchers have shown that increased liver stiffness was associated with increased incidence of liver tumor, including hepatitis B and hepatitis C. So for the future, determination of the cutoff value is another issue because in the present state, the liver stiffness measured by the different machines are not interchangeable. So before it can be widely adopted in the clinical guideline or follow-up for the patient with this chronic liver disease, integration of the different vendor and cooperation between the researcher and the vendors are important to solve this problem. And as I have said, using liver stiffness, we can apply this technology not only for liver fibrosis, but also we can use it as a clinical marker for management of liver disease. In this slide, I would like to show the status of research or publication. When I type in the elastography and the liver in the PubMed, which is a largest search engine for biomedical research in the world, we can see the publication of the liver elastography flourished as the development of the ultrasound elastography machine. And as we can see some of the milestones, including the marketing of the FibroScan and other shortwave elastography, followed by the recognition of this technology by the healthcare authority. So in summary, liver elastography enables us to measure the liver stiffness quantitatively and non-invasively. And most widely, it is applied in the diagnosis and management of the liver cirrhosis. As liver stiffness is affected by other factors, as a whole, it may become a biomarker for prediction of the patient outcome and various clinical situations. Thank you.